Good morning, everybody. It looks like we are just waiting for a few more people to join us. We see our participant numbers going up, which is great. We hope you are all doing well this morning. This is our webinar about health insurance requirements and immunizations at UC San Diego, and we will get started briefly. Okay, it looks like we've kind of paused on the number of participants that are coming in, so we're going to go ahead and get started this morning. So again, good morning, everybody. Thank you so much for joining us. I just do want to briefly let people know that before we get started here, my name is Gabriella Hoffman. I'm the Assistant Director for International Student Experience and Engagement at the International Students and Programs Office at UC San Diego. And you are joining us this morning, California time, for the Student Health and Immunization Requirements for Graduate Students webinar. This session is being recorded, so do know that a recording will be available at iwebinars.ucsd.edu within about the next week or so. Again, my name is Gabriella Hoffman, and I am joined by several different colleagues here this morning from UC San Diego. We have Shauna Slebiota, who's our Student Services Advisor in Professional Development and Retention in the Graduate Division, who's going to be going over some graduate admissions reminders this morning. We have Jill Patika, our Billing and Insurance Manager from Student Health Services. She, along with Annie Horton, our Nursing Supervisor at Student Health Services, will be presenting the bulk of the presentation this morning and will be available for question and answer at the end of the presentation. My colleague, Grace Fuller, our Manager for International Student Experience and Engagement, is also here this morning and will be joining all of us for question and answer at the end of the presentation. Okay, so just a brief overview of what we're going to be covering today. So we're just going to give a brief introduction about the International Students and Programs Office and what we do. We'll be going over the ISPO grad student checklist, so going over our iNew student website, as well as graduate admissions reminders. Then we will launch into the main part of our presentation about student health services, as well as immunization requirements. Then toward the end, I'll go over some of our upcoming webinars that you can keep an eye out for. And as I mentioned, we will have a question and answer session at the end of the presentation. We do ask that you hold your questions for the end of the presentation because we will be covering a lot of information and it might be covered in that Q&A. All right, so for the Q&A portion, I just want to familiarize you, if you aren't already, with the Zoom Q&A functions here on the control panel. You should all have a Q&A icon in the bar along your screen that allows you to ask questions. So again, you just type in your question. It will go to all of the panelists. And at the end of the presentation, I will be asking certain questions out loud if we're seeing common questions come through. We want to make sure that everyone can benefit from the answers to those questions. No identifying information will be released. We aren't giving people's names or anything, but we do want to ask some of those questions out loud, and we'll do our best to get to all the questions that come through. All right, so first we're going to go quickly into the ISPO website and our first steps checklist for those of you who have not visited our site yet. We highly recommend for all new international students, our graduate students, that they check out our inewstudent.ucsd.edu page as soon as they've accepted admission to UC San Diego. This, along with other helpful checklists on the Graduate Division website, will guide you through the process of next steps, particularly as an international student. So you'll see here, there's a graduate student section just for master's and PhD students. When you click on that, it will actually take you through step-by-step on what to do, including requesting your immigration documents, things you need to do before you arrive, and then things you can do once you arrive in the United States. So definitely take a look at the site, bookmark it, make sure you're keeping up to date. This is where we update relevant information for you as well. Okay, so now I'm going to go ahead and turn it over to Shauna to go over some reminders from graduate admissions.
Thank you, Gabi. I just, wanted to put in some reminders here. So please log in to the Grad Apply system to fill out your statement of legal residence. Another item that I wanted to include here. So most students are admitted provisionally. This means that we have processed your admission with unofficial documents. And to make your admission final, you must submit official documentation to the graduate admissions office. So this is usually an official transcript from your previous institutions. It may also be final test scores if those are still missing. It's best to have these documents submitted over the summer so our staff has plenty of time to process them. So please have that sort of on your to-do list as well to send all of those items to our office. And if you have any questions, please contact gradadmissions@ucsd.edu and our graduate admissions staff will help you out. This is a screenshot of the application portal in our application system, and this will show you what pending admissions documents are you still need to submit. So about halfway down the page, this is where your admissions documents that we need official copies of would be listed. The other thing I want to point out on this page is in the bottom right-hand corner where it says admitted students. So this is where you will find a list of items to complete now and before you arrive on campus and when you arrive on campus. And these are reminders from Graduate Division, and you can link out to all of those in your application portal. So I just wanted to mention that all to you. And again, if you have questions, feel free to contact our office.
Great, thank you so much, Shauna. So now I'm going to go ahead and turn it over to our colleagues in Student Health Services, starting with Jill this morning to talk about student health.
Good morning. Welcome to UC San Diego. This information that I'm going to give you is going to introduce you to the services available at UCSD Student Health Clinic. We'll also discuss the insurance requirements for students and what insurance is offered to you medically. Our agenda, we're going to go over what services we provide at Student Health, your enrollment in our SHIP program, which is an acronym for Student Health Insurance Plan, filing a health fee waiver, your fee-for-service options if you're a cash-paying patient in our student health clinic, our enrollment into our Raft program, which is a reduced access fee for Tritons, and our contact information. Student Health on Campus offers primary care physician services. We have a lab, x-ray, a nutritionist. We have mental health services. We are partners with our counseling and psychological services throughout our campus. We provide optometry, insurance services, and other services here at our student health clinic here on campus. We are one of the only entities on campus that is here year-round, so you always have services available to you, even during the summer, spring break, or winter break. Appointments can be made online for immunizations or nurses clinic, or by calling our main campus line to schedule. We're here Monday through Friday. We're also here on Saturdays. Our urgent care is open from 9 to 12 p.m. And we're here, as I said, fall, winter, spring, summer. We're open during the quarterly breaks, and our phone number is there for you to access to make appointments. We have just about over 40 practitioners here, medical doctors, doctors of osteopath, registered nurses, nurse practitioners, people that can service you and provide a primary care physician home for you. Next slide, Gabby. In our clinic, we provide services for the payers, which are SHIP, Raft, and fee-for-service. This current year, the cost per quarter for you to have insurance through the school, and this is one of the health fees that is on your registration fee, it is $1,300 currently per quarter for a student to have the insurance through the school. And this is automatically billed to every registrant throughout the UC system throughout the state of California. If you look at it on an annualized basis, you're paying for 3 quarters, which equals $3,900 a year. Or if you wanted to look at it on an average per month, it's $325 per month. It is a comprehensive Anthem Blue Cross PPO benefit that provides you with dental, medical, pharmacy, and optometry services. Their services are also covered globally, so you have services available to you if you're in your home country. We do provide 60% reimbursement to those services that are outside of the US. If you're accessing care, we have 3 tiers of benefits under the student health insurance plan under Anthem Blue Cross. The first tier of benefits is offered under our UC family. We have UC hospitals and UC medical groups throughout the state of California, and they provide 90% coverage for any hospitalized or diagnostic service. It's a $10 copay to see a UC specialist, and if you're here at Student Health, there is no copay to you. All services are covered for primary care scheduled visits, lab work, and x-rays here in our clinic. If a doctor here refers you to a specialist or to have a hospital service, we generally are going to refer you to the UC system so your benefits are maximized. You're paying 10% out of pocket and a $10 copay to see a specialist under that first tier of benefits. Under the second tier of benefits, you have PPO network, which means that any contracted provider that has a contract with Anthem Blue Cross is covered at 80%. But there is a $500 deductible that comes into play, and you have to pay that first before the benefits kick in. If you're seeing a specialist, it's a $30 copay, but if they do any diagnostic services like lab work, x-rays, or admit you to a hospital, those services require that $500 deductible be met, and then the services are covered at 80%. You continue to pay 20% out of pocket. If you go to an Anthem Blue Cross primary care physician outside of the student health clinic, you pay a $20 copay. The third tier of benefits would be out of network, which we highly discourage, but those services are covered at 60% after a $1,000 deductible is met. Our cards are not mailed to you. There are no hard copy insurance cards. We ask that you download a mobile health app to your phone, and that will include the cards and any benefits, or if you wanted to look at claims and review that. You go to the App Store and download the word Student Health, all one word, and your insurance card will be right on your phone. To find out about benefits, you can go to our website, studenthealth.ucsd.edu, or our Office of the President, ucop.edu, UC SHIP, and you'll be able to look up any of the benefits that you might want to find out more details on. We have an opt-out program here, so every registered student is automatically billed for the student health insurance plan. If you have comprehensive insurance that you want to use instead of the student health insurance plan, you have to waive out of that. And you do that during the open time frames. For the fall quarter, our waiver period, if you go in through your Triton link, students.ucsd.edu, look under financial tools, click on the health fee waiver, you fill in your application for a health fee waiver using your home insurance information, and we will need you to scan a copy of your insurance card so we can verify its validity and your benefits. The waiver period for the Triton link will open on May 1st and stay open until September 1st this particular year for the fall quarter. And if you're waiving the insurance requirement, you're waiving the entire school year. So when you file the waiver before fall, you're approved for fall, winter, and spring, and you just need to renew it each school year. If you miss it during the fall quarter, there are no exceptions to get into the waiver outside of the open time frame. You would have to pay for the insurance for that particular quarter, but the waiver does open about a month before the winter quarter and a month before the spring quarter if you do miss it before the fall. We don't make any retroactive determinations. You would have to pay for fall, and if you filed the waiver in winter, you'd be approved for winter and spring, but then you'd have to refile it before fall if you wanted it recognized for the next academic school year. We do make cancellations or alterations to that waiver. You just need to contact our offices and discuss your situation with us, and we'll be glad to help you. But if you do plan to opt out of the insurance requirement, please do it during the open time frame between May 1st and September 1st this school year. If you do file it late, there will be a $50 copay or $50 late fee that's attached to your account. A lot of our international students do file health fee waivers, and I just wanted to provide you with 3 of the online options that a lot of our students use in order to meet the waiver requirements. You have to have comprehensive insurance in the United States that meets our Affordable Care Act, and these 3 plans are recognized by the Office of the President as plans that meet that. If you wanted to go online and file a health fee waiver and you had this kind of insurance, you would be approved and you would use this insurance instead of the student health insurance, but you still could come into the student health clinic and be seen. You just would have to pay for the services as you go and then seek reimbursement afterwards. If you do file a health fee waiver and you don't want the school insurance, things to keep in mind are that the services here in our student health clinic, you're welcome to have them provided to you, but you do have to pay for the services as you go. One office visit can equate to about $100 in US dollars, and you would have to get a receipt for that and then file reimbursement with the insurance that you've purchased outside of the school insurance. You'd have to wait for that reimbursement so you have that money back in your pocket. We do provide itemized statements to assist you in that process, and we will assist you if you do have any questions on the billing or sending in reimbursement forms. If you decide that the insurance that you purchased on the outside isn't as good as what the student health insurance plan offers, you can always file a cancellation to the waiver, and we will put you on the student health insurance plan. The only problem is they don't deduct any cost of that. They don't prorate it or reduce the cost of it. So you would still have to pay that quarterly fee. And this year it's $1,300. So that is a lot of money to consider, and depending on the time frame, how much time you're going to have covered. But it is an offering. We do provide it as a resource to you if you do change your mind. Also, something to consider, we do offer what's called a Raft. It's a reduced access fee for Tritons. And what that means is if you have decided to purchase an insurance outside of the student health plan that we offer, if you want to come to the student health clinic and not pay those extra services or work with the reimbursement, you can pay $65 per quarter to grab a Raft. And that means that you're paying basically a membership to come into the student health clinic and be seen on scheduled appointments and have in-house lab services at no additional charge out of your pocket. But you do pay a $65 fee per quarter. But as I said, one office visit can equate to about $100. If you're paying $65 per quarter, you can have as many scheduled appointments and in-house lab services during that quarter at no additional fee, so that can pay for itself pretty easily. If you need an x-ray, there is an extra charge. It's a $25 charge to have an x-ray, and if you are referred to a specialist or need to pick up a prescription, you would want to use your home insurance for those services. You could do that here in our clinic, but you would want to use your home insurance so you maximize your benefit under that insurance outside. The Raft doesn't pay for optometry or send out labs or pharmacy or immunizations. So that is something that you would have to pay for out of pocket and then seek reimbursement back from your outside insurance. So just some caution when you're deciding whether you're going to opt in or out of the insurance. If you do have questions, our offices are here year-round. Again, our website is studenthealth.ucsd.edu, or you can contact our Office of the President website at ucop.edu. Our phone number is there for any questions that you might have, or if you want to send us an email, we'll be glad to answer that email. We're at about a 3-day turnaround time on emails, so if you want to send us something, it may take a little bit of time to get the answer. You could call us and get an immediate answer. Right now, our offices are working remotely, so we are not here on campus. But if we were, we are located right across from the student bookstore on Library Walk, right down from the Geisel Library.
Good morning, everybody. My name is Annie Horton. I'm the nursing supervisor here at Student Health Services, and I'm the project lead for the incoming health requirements for UCSD. I want to welcome you all here and congratulations. I know that there's a high level of uncertainty around healthcare at the moment, but we just want to let you know we're moving forward with all of the regular incoming admissions process on our regular timeline, and we are here to support that process. And so I'm here just to outline what the health requirements are for the 2020-2021 year. Okay, so what are the UC incoming requirements? Currently they are, in 2016 actually, the University of California as a whole mandated that all incoming students complete tuberculosis screening and prove immunity of certain communicable diseases, and these were recommended by the California Department of Public Health. As it stands currently, we require tuberculosis screening, and for some students, and majority of those of you coming from outside of the US, that also includes tuberculosis testing. Testing is risk dependent, and our system will guide you as to whether you need to do that. The immunisations currently are Tdap, which is tetanus and pertussis. In most foreign countries, this is not a vaccine that is available to you, so we do allow foreign students to obtain this during the full quarter. The second vaccine is measles, mumps and rubella. The third vaccine is varicella or chickenpox. And the fourth, if you are 22 years or younger, is also the meningococcal vaccine. So that's the MCV4, not the meningococcal B. If you have had any of these diseases, we need proof of immunity via a blood test. And at this point in time, exemptions only exist for medical reasons, not for personal or religious reasons. Why does the University of California have these health requirements? And it's basically about protection, protecting you and anybody that you come into contact with, therefore the entire university community from preventable communicable diseases. We have seen outbreaks, and clearly we're in the midst of one globally at the moment, but outbreaks of tuberculosis, of measles, of mumps, of meningitis in university college settings that have caused significant personal and academic disruption. So we want to do as much as we can to protect our community from these diseases, and those that are more vulnerable, those that are immunocompromised or unable to have vaccines due to medical reasons. How do I start this process? Well, Student Health Services administers the incoming requirements, and these are housed within our secure UCSD Health electronic medical record called EPIC. The student portal is called My Student Chart, and is activated with your AD login. You'll be issued a campus username and account shortly after accepting an offer of admission at UCSD. I do have a link there that if you have any issues setting this up, that you can refer to that. Your access into the Student Health portal is determined by when you accept your position in the university. So we are doing monthly student loads into our system, so you can assess when you might expect to gain access. Until you are in our system, you will not be able to get access. If you have any issues, I will provide an email where you can reach out to us for more information regarding that. This is what the landing page looks like in My Student Chart. Once you've activated it, you will find all of this information on the landing page. There are several ways of getting to the screening details. You can go to the number 1, which says health, and click on immunization or screening, or click any of the links below, and that will take you to where you need to go. And these are the two compliance components that sit on my student chart. The first one is TB screening. Clicking on that will take you to a series of screening questions. And the second one is the immunization history screening, which will require you both enter dates of all your vaccines and blood titers, and also upload records, either our form or your own vaccine records. So the first one is tuberculosis screening. We want to prevent anyone with active tuberculosis from coming onto campus. So we really encourage everyone to get the screening done prior to coming onto campus. Your deadline, as you can see, for graduate students isn't until November 1st, but we really would encourage you to get this done prior to coming here. Once you've completed your TB risk screening questions, the system will let you know regarding TB testing. If you're coming from outside of the US, you will likely need this. There are a variety of tests that are acceptable. The blood test is the gold standard, but skin tests are accepted, as are chest x-rays. It's important to begin this process as early as you can, because some students need to get additional testing done depending on the results of chest x-rays or any of the other testing that we want you to get done, and it can be quite a long process. So please don't leave this to the deadlines, because you might find that you are prevented from enrolling in the classes that you want. All records need to be in English, please, including the chest x-ray report. It's important to supply us with all of the requested information on the TB testing form. Failure to do so will prompt one of our RNs to message you with a request to obtain that missing item, and again, that may take you some time. So please just have your healthcare providers follow the details that we need on that form, and you should have everything on there that's needed. Our immunisation requirement deadline for grads is also November 1st. Before completing the online submission, you'll need to have gathered all of your vaccine records, or have taken our form to your healthcare provider. The advantage of taking our form to your healthcare provider is that they can guide you through this process, provide you with missing vaccines, and also order blood tests if you need to prove immunity to measles, mumps and rubella or varicella. It's all of our forms you can find on our Student Health Services website. This is what the online form looks like. So if you hover over any of the wee eye bubbles, it will give you additional information, and it may tell you why the system isn't accepting your dates. And common reasons for not accepting dates is that you may have received it too early, or not had the recommended gap between a vaccine series. You can enter the dates of blood tests, and it will also ask you to upload the results of those blood tests. Once you have submitted all of what's required, now the first section are required vaccines, the second section are recommended. So the compliance is only attached to the first series, the series of vaccines that I outlined at the beginning, but we have provided you space to add additional vaccines that you may have had, because it's extremely helpful clinically for when and if you become a patient here at Student Health Services, or even a student on campus, because when we have outbreaks, we reach out to people to either recommend they get vaccines, or to let you know that you're immune. So it's extremely helpful information to enter as many dates as you have. And I do want to say our student SHIP insurance covers all vaccines, including travel vaccines, which is very unusual for an insurance program. So if you come here needing some of these vaccines, SHIP is a very, very good health plan to have for this. As I said, TDAP may not be available to you, but rest assured you can get it here once you come to school. And how can you get help? Once you are able to activate your portal in My Student Chart, you will be able to send as many messages as you need to Ask a Nurse, and that comes directly to my team. And I have a sizable team of RNs or registered nurses that are constantly answering these questions for you. They are going through your submissions. They will send you messaging if there's an issue or you need more testing or you're missing a vaccine. So please keep checking into My Student Chart, because you may think that you've hit all the compliances, but one of our nurses might be reaching out to you to let you know where you're missing something. So it's very important that you keep plugged into your health portal. I do have an email there that comes to our medical records department if you're having technical difficulties, and they can triage those technical difficulties for you. Please do not include any health information, because email is not a safe way to send health information. So we can't respond to any clinical questions through email, but our medical records team will help you if you're having technical issues, for example, uploading or getting into your student portal. Student Health Services has a website, and it has a page dedicated to this process, and so all of the forms and deadlines and everything is housed on there, as is the Graduate Division website that also has all of the same information. So you can definitely reach out in a multitude of ways to help you complete your incoming requirements. And so failing to do your incoming requirements does result potentially in an enrolment hold, which would, for graduate students, prevent enrolment in the winter quarter. So it's very important that you get these done in a timely manner. And as I said previously, medical exemptions are the only opt out of this, and on our website it outlines our policy, and it also provides a form if you have an allergy or a health condition that means you can't get a vaccine, for example. You would take that form to your healthcare provider to fill in, and give us the details that we need to be able to approve that exemption. But we are here. We can't acknowledge the receipt of your documents, but we will let you know when you achieve compliance or if there is something missing. The nursing team and myself are here to help you through this journey. So please reach out to us. Thank you. And that's, if there are any questions that you have, I'd be happy to help answer them.
Thank you so much, Jill and Annie. And I see those questions coming through, which is perfect. We're getting into our question and answer session. Just before we jump in and start asking some of those questions and getting answers, I just wanted to quickly provide some reminders about upcoming webinars similar to these that will be happening throughout the month of May. So do be aware, keep on the lookout on our iwebinars.ucsd.edu site, which is also where this webinar will be posted since it has been recorded. We're holding a series of 3 more webinars for graduate students. May 7th is our webinar about TA-ships and TOEFL requirements. May 12th is about campus safety. And on May 14th, we're going to be focusing on student life and getting involved on campus. So again, that link is iwebinars.ucsd.edu. All right, so we're going to go ahead and open it up for question and answer. I'll take a look here and see what we can get started on. So one of the questions that's come through, and I imagine will be a common one, is what if students aren't able to get some of these tests or vaccination evidence due to the pandemic that's occurring right now?
Yes, it's a really good question, and we really do understand this process that's going on, because clearly it's affecting everybody at the moment in different ways. So what I would say is do as much as you possibly can, and if you can receive this vaccines or TB testing, please go ahead and do it. If there's absolute barriers to doing that because of your local response to COVID, then you should reach out to us and let us know, and we can offer additional guidance on that.
And then there's another question that has come through. What if, I've already received or taken the BCG or tuberculosis vaccine in childhood? Do I still need to submit a tuberculosis screening?
Yeah, that's a really good question too, and very, very common for countries outside of the US. Yes, we know that BCG does not offer lasting protection against tuberculosis, and the countries that provide BCG to their children are usually countries that do have a higher risk of TB. So we do need you to complete screening and testing. We know BCG makes it more probable that you will have a false positive to the skin test. So we do encourage students as much as possible to get the blood test if it's available to you. But if it's not, please do go ahead and get the skin test.
We have another question here about what information is available about health services at UCSD for graduate students who have dependents. Is there information on the website for individuals with dependents?
Yes, graduate students can add a dependent, a spouse, or if they do have a marriage certificate with a partner, they can add dependents. The time frame for coverage is the same as the student, so it runs along the academic school year. The student that is registered with us would need to contact a company called AHP. It's Academic Health Plans. That's who we partner with to enroll dependents or spouse. And there is an additional cost to that. It's generally about $1,000 per person per quarter. That information is on our website at studenthealth.ucsd.edu, and it's about registration for dependents. Just click on that tab, and it'll take you to the questions that you may have yourself. And it also gives you the contact information for AHP and how to enroll.
Great. And then another question. So someone here wants to know if they've had a TB vaccine in their hometown, but their medical records proving that it's not in English, should they get the vaccine in the United States again?
So if that's for tuberculosis, that's not a vaccine that is provided here, and TB testing is going to be needed regardless of the BCG vaccine.
Okay. And then someone here wants to know if they don't have proof of immunization, as most of them were, given much, much earlier in childhood, how would a person go ahead in that situation?
You would go ahead and go to a health professional and have blood tests done. The blood tests will give you proof of immunity to varicella or chickenpox, measles, mumps, and rubella. The only ones that it won't provide proof of is Tdap, and that would be a vaccine you would need to get, and dependent on age, also the meningococcal vaccine. Those ones possibly weren't given. If you are of an age where your vaccines were a long time ago, you probably won't have received Tdap or meningococcal vaccine as they weren't around.
Great. I'm just going through some of the questions here. We understandably have quite a few that are not so much health related, but more about what fall quarter is going to look like due to COVID-19. I know a message was sent out by the graduate division to students, letting them know that online options are available for graduate students as well as undergraduate students for fall quarter. That will be addressed separately. More information will be sent out, will be posted here, as you can see, in the inewstudent.ucsd.edu webpage for information on how to proceed. Since this webinar is focusing on health in particular, we want to focus on those questions, but do know that we know this is a really, really important topic for all of you, starting fall quarter and what that might look like if done online. So do know that is going to be addressed, and communication will be sent out to all of you in those in this situation. Okay. Here's a good question. So are visits to a psychologist fully covered by SHIP? Is there a cap on the number of sessions that can be attended by a student?
That's a great question. SHIP does cover them in full. If the student is accessing care here on campus through our counseling and psychological services, they will take on students. Generally, it's about 5 to 20 visits here on campus that are free of charge to the student. And then if they need to be assisted or transition off campus to a private provider, the services are covered with a $5 copay for a UC provider or a $10 copay for an Anthem Blue Cross provider. So they are covered, and if you need further assistance on that, contact our offices and we'll be glad to assist you with that.
Great. And here's a great question too. Is health insurance UC SHIP localized only to the California region, or does it go beyond?
It is national as well as global. So the services in the United States are recognized under the Anthem Blue Cross umbrella of insurance. And then once you leave the United States, you have 60% coverage for any global provider, but that turns into a reimbursement plan. So if you are outside of the United States, you access care, you pay for those services, and then when you return to the United States, you file a claim form and you're paid back at the percentage that's available based on your benefits.
And here we have a question about the flu shot. So someone wants to know, is the flu shot required to be taken before coming to the US? And if yes, how early? And the second part to that question, does the TB screening need to be done in their home country or here at UC San Diego?
Okay, great questions. I'll answer the first. Influenza vaccine is not one of the required vaccines, but it's highly recommended, and we run a series of flu clinics through the fall quarter. I don't know quite how that's going to look this year, but we still will be offering it, and we also offer Tdap vaccine during those flu vaccine clinics. But if you have access to it where you are prior to coming on campus, I would really encourage you to do that. I mean, the prevention of any respiratory illness through the COVID situation is highly, highly recommended. The second part of the question was regarding TB screening. Oh, yeah. Yeah. The preference is that you have it done in your home country, but if that is not available to you, you can absolutely have it here. Yeah, you can.
Great. And then someone here wants to know, is the meningococcal immunization required only for students younger than 22 years old?
Indeed, yes. There's increased risk from the age of 22 and below, especially in a college setting, but it is recommended, strongly recommended up to the age of 23, and it's also recommended for international travel into some parts of the world.
And I know we talked a little bit about this early in the presentation, but someone here wants to know, since November 1st is the deadline for submission of vaccine proof, can we do those vaccinations when we come to campus by September?
Yes, you can. We would prefer it done sooner than that, but yes, we absolutely can. And just again, I don't know how the delivery of healthcare for routine care is going to look during the fall quarter. We have in previous years had a huge demand on services for immunizations, which has resulted in a lot of students being in our building, and clearly that's not going to be possible. So it will all be probably done through appointment to be able to manage the numbers of students coming in. So it may be that the vaccine that you desire is going to take a little bit longer to be able to get. So just bear that one in mind, but they will be available here. Yes.
Great. And someone here wants to know, is the HCV vaccine a requirement for incoming grad students?
Do they mean HPV?
Possibly.
Yes, I think so. It's not required, but it is available here for all genders, and it is included in the SHIP insurance.
Great. Okay. Just scrolling through to see if we have any other relevant questions.
Gabi, this is Shauna. There is a question about submitting documents that I wanted to address, and this is asking about courier services not being available and submitting pending admissions documents. So some universities are able to submit documentation to our office securely and electronically. And so your university might have that ability to do so. So I would recommend looking into it, looking into if that's an option for your institution. And that would be a way that we could still receive the documentation. Otherwise, once the mail is back up again, just trying to get that request in so that it can come through once we are back up and running, would be my answer to that.
Great. Thank you, Shauna. So it looks like we have just a follow-up to that question, Shauna. I don't know if you can jump in. What is the deadline to submit pending documents?
So we would just to similar, I think, to what Annie was just saying about a lot of requests at the same time, to give our admissions staff plenty of time to process all of the documentation. We would prefer if you can submit those documents over the summer before the fall quarter begins. Now, that being said, we know that there are people that will arrive with their documentation in hand, and that is fine. If we don't receive your documents by, I can't remember the exact date, but if you don't have your documentation submitted by the time that registration begins for winter quarter, then there would be a registration hold, which would prevent you from registering for winter if we have not received it at that time. So keep that in mind and try to submit as early as you can.
Great, thank you. Another question here, just going back to vaccines. So someone wants to know, they're turning 22 about a month before coming to campus for the fall. So in that case, would they still require a meningococcal vaccine, or is it optional?
I would recommend getting that. It provides approximately 5 years of coverage of immunity for NCV4. So it's a really valuable investment to make. Whether our system picks the person up as needing it or not, I'm not 100% certain because we have just switched to a new system. But yeah, I would recommend having that vaccine.
Great. And another question here, does UC SHIP cover pre-existing conditions?
Yes. In the United States, the Affordable Care Act that was passed a few years ago requires that insurance companies don't discriminate and they don't prohibit anyone from having a pre-existing condition or disease process from adding insurance. So that is not a problem. You can certainly join our insurance without any issue.
I know we talked a little bit about this earlier, but someone's just asking again, are any vaccines taken during childhood? Would those work as well toward the requirements?
Yes, absolutely. As long as you receive them in the appropriate age sequencing, they will be acceptable, yes.
Great. Okay, just looking through to see any other questions here. Oh, what are the options for mental health care on campus?
So we have our counseling and psychological services. They provide about 26 psychologists throughout the campus in different residence halls and different colleges where students can access care at any moment. Otherwise, you would come to the student health clinic and be referred to a counselor, either psychologist or psychiatrist, depending on your needs. And again, those are covered by the student health insurance plan. If you are referred off campus, a $5 copay or a $10 copay. Otherwise, here on campus, you're not paying anything out of pocket. But I encourage you to look at the CAPS website. It's caps.ucsd.edu, or you can reach it through a link on our studenthealth.ucsd.edu website.
And we also have a question about dental treatment. I guess this person wants to know what exactly is covered. I know that might be, more of those details might be available on the website, but just generally, is dental coverage included with UC SHIP?
It's a great question. The dental services that are provided under the insurance are sort of limited, but it does provide an annual cleaning with x-rays and an oral evaluation at 100%. And then any services like cavities, root canals, or tooth extraction, those services are covered at 80% and the student pays 20% out of pocket. It is a limitation of $1,000 worth of coverage per school year, and that's US dollars.
And kind of a follow-up in a way to that, in terms of insurance coverage, if someone were to be hospitalized, how much of hospitalization is covered by SHIP?
There is no limitation to the number of dollars that are spent for health insurance. So there is no cap on anything, any disease process or hospitalization. If a student unfortunately ends up in a UC hospital, at a University of California hospital, the services are covered by Anthem Blue Cross at 90%. The student pays 10% for any hospitalized services. If it's an Anthem Blue Cross provider, they're covered at 80%. An additional $500 deductible is required. And then if they are out of network, that means that the hospital or the providers are not contracted with the insurance company. That's payable at 60% by the insurance, but the student has to pay $1,000 and 40% of any bills for hospitalization.
Okay. We have one, another COVID-19 related question, or the impact at least, with remote instruction. I don't know if we're able to answer it yet, if these details are going to be released soon, but if fall 2020 is held virtually, the student wants to know, would international students still have to pay for healthcare services during the fall quarter if they're not physically here?
Say that one more time. I'm sorry, Gabby.
Yeah, so if fall 2020 is held virtually, if classes go online and international students are not here in the United States, they're taking their classes remotely, would they still have to pay for health insurance services during the fall quarter?
I apologize. If they are registered students, they're still held to the same compliances as anyone that is participating here on campus. So yes, you would either have to pay for the school insurance or opt out of it by filing a health fee waiver.
Great, thank you. And someone also wants to know here about basic eye treatment. So is that covered under UC SHIP eye exams and things like that?
Under the SHIP insurance, optometry is covered. It is a limited benefit. They do provide an annual eye exam. It's a $10 copay for students. And then they provide $120 that you can use towards paying for glasses and frames or contact lenses one time per school year. In our student health clinic, we do have a full optometry unit. We have 4 licensed optometrists, and we do sell retail glasses and contacts.
Okay, I'm just looking through here. I just wanted to once again address for any questions that came in afterward, but questions regarding online or remote learning for fall 2020 will be addressed separately in different email communication or webinar or communication from Grad Division. Since this webinar specifically is about health insurance, so the topic we're focusing on today, but I just wanted to let those students know we're not ignoring your questions. There's a lot of information that still has to be worked out by the university. Once those pieces are worked out, we'll be providing you more updates so that you have all the information you need to move forward with your decisions about things. It looks like we have reached the end of our questions regarding health and UC SHIP. So I want to say thank you to our panelists today. Thank you so much for presenting this valuable information. We have reached the end of our Q&A. So I just want to let everybody know again, this has been recorded. We will be uploading it to the iwebinars.ucsd.edu webpage. So look out for that. We encourage you to join us for our future webinars coming up in May, and also keep an eye out for communication in your inbox regarding plans related to COVID-19, the impact of that for fall quarter. So thank you all again for your time. We really appreciate it. We hope you're all keeping healthy and safe, and we look forward to seeing you soon. Take care, everybody.
Thank you.
Thank you.